I'm Dr. Anthony Gonzalez here talking to you about another important health topic. Today and November is Healthy Skin Month. So we're going to talk about healthy skin and learning about how to take care of your skin. And obviously, you may or may not know, but the skin is your largest organ in your body. So you need to take care of your skin. And of course, to take care of your skin, you need to bring a specialist, an expert. And we brought our dermatologist, our friend, our colleague, Dr. Javier Flores. Welcome.
Thank you, Anthony. Thank you for having me.
All righty. So dermatology obviously is a specialty that takes care of the skin. So tell us a little bit about what you do and what a dermatologist does.
I'm a board certified dermatologist. I've been in practice for 22 years. I trained at the University of Miami where we met back in the day. I run 3 offices, one in the Coral Gables area, one in Doral, and one in the Florida Keys, where we deal with a lot of skin cancer.
All right. And so let's talk a little bit about healthy skin and what is important. And I know that sun, and you're mentioning the Florida Keys, sun is obviously damaging to the skin. So tell us about the sun and how damaging it could be and what should you do to protect yourself?
So our skin is being the largest organ in the body. It offers the first protection against the harmful effects of UV rays, particularly UVB and UVA. So to that end, we need to know how to protect our skin. The most common way is to use the proper sunblock. And some of the ingredients that I recommend when you go label check is to make sure you find zinc and titanium dioxide in those labels, because that offers the most immediate and effective protection. The SPF should be around 30. You don't need to get crazy with a high number like 80 or 100, because those are usually provided in sunscreens that need a chemical reaction on the skin to provide that protection. The physical sunblockers that contain zinc and titanium dioxide with an SPF of 30, maybe up to 50, those work right away.
And then also, you were mentioning telling me that you need to be reapplying that, right? Because it fades off.
Yes,
what tell us about
important.
that?
More important than that SPF number that a lot of people tend to over-focus on, I would say reapply every couple hours, because the effect wears off, particularly if you're in the water or doing some type of water sport or a physical sport where you're sweating. Reapply every 2 hours. That will give you the better protection.
And then what about protective clothing? Is there things that we need to be, is it useful protective clothing? And are there certain things we should be looking for in the protective clothing to make sure that they are protective?
Yes, so protective clothing I think are very useful, and they allow you what I would call cheat, because you can wear these type of clothing on your main skin, and then apply the sunblock on your face and critical areas like the hands, the exposed areas. And what you should look for is that particular clothing has a UPF of 50, and you'll find it typically at the fishing stores or the sports clothing stores. They're pretty easy to find there.
All right, and then hats. Hats important. Should you be wearing hats? Does hat give you complete protection of your face, or is reflection a problem as well?
Yeah, reflection is definitely a problem, but that doesn't mean the hats aren't useful. Hats are absolutely useful, particularly in people who are balding, because the balding scalp is very prone to absorbing those harmful rays. So a wide brim, in the ideal world, you want to use a wide brim hat that covers the ears, because the ears are the helix area of the ear, very, very thin skin, and can turn cancerous pretty quickly if you don't protect it.
All right, and then what about sunburns? Obviously we don't want to get sunburn is what you're telling me, but any type of piece of advice with regard to sunburns and tanning salons, tanning beds? Talk to us about that.
Yeah, so I'm glad you brought that up, because tanning beds are absolutely a no-no for us. We absolutely do not recommend that anyone, under any circumstances, and I know it could be a lucrative business, but do not go to a tanning bed. A sunburn, just one sunburn in your life can double your risk of melanoma, your lifetime risk of melanoma. So that's a problem. So tanning beds, you're really doing yourself a lot of harm for no particular reason.
All right. And then let's talk about care of the skin. We're in a Healthy Skin Month. We're in November, Healthy Skin. What are kind of the routines that you should be going into and really following to maintain a healthy skin? We already learned that avoiding the sun, putting on sunblock, no burns, no tanning salons or tanning beds. But are there certain other things that we should do to maintain a healthy skin?
Yeah, so that's a question that I get asked almost daily by all type of people, men, women,
patients, friends.
Yes, absolutely. They want to know in this day and age what's the best way to take care of, because in this era of social media, you get a lot of people trying to sell you stuff and oversell you stuff that quite frankly is not necessary, is not really doing what they're saying it's going to do. So you tend to overspend money for no good reason. So what I recommend is keeping it simple. And to that end, all you need is a nice cleanser in the morning. Some people then will do a toner, and everything depends also on your type of skin. If you have dry skin, oily skin, so you vary some of these recommendations depending on that type of skin. But again, keeping it simple, you cleanse, you apply a vitamin C, and if you can find a vitamin C/vitamin E serum to the face, you do that, and then the final step is a sunblock before you go out. And then at night, you repeat the step of cleansing, and then you would apply a cream containing a retinol or retin-A type of acid. That is the simplest thing, and it's almost like brushing your teeth for the skin without overdoing it.
Wow, that's great. And then how often should somebody be checked, going to see, primary physician versus going to see a specialist like you? Are there certain types of people that should be checked more often, less often? And should we be going to a dermatologist to look at, our moles?
Yes. So absolutely, the primary care physicians are the first point of contact for most patients. So they get to see a lot more patients that I do, and they're very important in picking up those potentially problematic moles or lesions that can look like something cancerous. So I get a lot of referrals from my colleagues for controlling and checking particular lesions. And so yes, absolutely, anything that's not healing in your body, you need to discuss it with your primary care doctor. If you don't have a dermatologist in your annual checkups routine, discuss it with your primary. They can usually direct us our way. And then once you get to us, we identify who the problem patients could be. Regardless, I recommend a skin check at least every couple of years, even if you have absolutely nothing. But patients who have a high, what we call load of moles, those patients need to see us more often. And depending on what we find, if we identify a particular mole that could be a problem, we may have that patient come back on a biannual basis. It could be, sometimes even more than that. But high load of moles, patients with a family history of melanoma or skin cancer, patients who are type 1, because we classify the skin depending on how light you are. But that doesn't mean that, if you're dark, you're home free and you can sit in the sun and just go careless with the sun, because even African Americans and dark-skinned individuals can get skin cancer. I don't know if you remember, but Bob Marley died of melanoma.
Wow, okay.
Yeah, he had a streak in the nail that he thought was a blood blister, and he ended up dying from it. So it's important for everyone to be aware of skin cancer and not take it for granted.
And then the moles, how do you know, I've had this mole here for forever. How do you know in looking at a mole if it's worrisome? Is there tips, that you would give your, the community and telling them, hey, things that you look at for a mole?
So we have a criteria to identify potential problematic moles. We use the ABCDE criteria, and each letter stands for something important. A is for asymmetry, meaning if you take that mole and you fold it onto itself, does it match? One half roughly match the other half. If it doesn't match, we call it asymmetrical, and that's a bad thing. Borders, if the borders are irregular, that's a bad thing. Colors, if they have more than one color, or it could be the same color, for instance, brown, and have different shades. And then coupled with the other criteria, the asymmetry and the irregular borders, that's another negative. And then diameter, if it's roughly the size of an eraser head. And finally, the one that I think is most important, which is evolving. The E is for evolving. Meaning, if you identify a mole or a lesion in your body that you feel is changing, and that's the first question I ask a patient when I'm assessing them. Is it changing? Has it changed? Is it bleeding? Is it symptomatic? Because if it is, itching, bleeding, burning, hurting, those are all problem issues. And that's a mole that I'm probably going to end up biopsying. So to that end, I recommend what's called the ugly duckling approach. If you see a mole, and you can have a ton of moles, but that particular one is not quite, you're saying, you're detecting that it's not quite looking the way it used to look, come into our offices and have us evaluated.
Isn't your loved ones, your partners in your family also a good source of that? They see things, right?
Absolutely, particularly in areas that on your back, maybe your private areas. And you could, by the way, you can have melanoma not only on you could have genital melanomas, anal melanomas. You can have eye melanomas.
Right.
So for a light-skinned individual, maybe a blue-eyed, red hair individual, that person needs to also see the ophthalmologist and make sure they get their eyes checked, because you have melanocytes in the uvea that can turn into melanoma.
And so back to our skin type, our African American colleagues, those with dark skin.
Yes.
So are they protected? Should they be concerned about?
I'm not going to deny that they do have more protection, natural protection, because the melanin absorbs, it acts like a natural sunblock. But the problem is, they can still get melanoma, and particularly in those areas we call it the acral areas, and that melanoma is called acrolentiginous melanoma because it can affect the fingers, the palms, the soles. So if you cheat on anything, make sure you check your palms and soles and your nails in that population, and don't assume that it's just a nail streak or a pigmented streak, a color streak, that it's just okay. Get it checked. Make sure that it's checked by a professional that can tell you it's okay.
What I'm seeing is that the skin is so big, and the body, the organ is so big. You need to have somebody who's a professional look at it, because if not, you're not going to know. That's just no way around it.
And unfortunately, I mean, just today I had, sometimes even with this, we use the ABCDE criteria. And I hate to admit it, just today I had to put in a call to a patient that came in, and she's the one that said, "Listen, doc, this is growing. I never expected it was a grade 2 melanoma, completely colorless, and those are scary. I haven't even talked about those. There's some melanomas that don't have any color. You can't even use this criteria. You just got to go by the symptoms that the patient tells you. And if it's something's changing, usually the patients, they're best. They know best. They know their body better than we do, because they're in contact with it every day. They know how to detect.
They know
things.
what's changing, what's different.
So they bring it up to our attention. And the important thing is that professional addresses it and maybe biopsy. Because if the patient is alerting you that something is not quite right, I think it's best to biopsy. So I had to put in a call for this patient. I was probably more surprised than she was. But sure enough, it's gonna hopefully end with a good result, because it was detected early, and we'll deal with it.
Right. So we're worried about all this skin check, and we're worried about healthy skin because we're worried about skin cancer. So let's get into skin cancer discussion. So the types of skin cancers, let's go over that, and then we'll talk about some of the good skin cancers and the bad skin cancers. So tell us a little bit about that.
Yeah, it's funny that we can say good skin cancer. and you can say that, and we group the good skin cancer into non-melanoma skin cancer, because melanoma is definitely bad. Now, even melanoma nowadays is not a death sentence. Back when you and I were training, melanoma was quite scary because the survival rate was atrocious. Now, with all the new therapies, and maybe we can talk a little bit about that, but there's hope, because we have all these immunotherapies, and every day we're developing new trials for new drugs that are tailor-made for the genetics of melanoma. So that's melanoma. But the most common is something called a basal cell carcinoma. And those present usually with a pearly lesion that may have a little blood vessel. It may bleed. So again, that bleeding is important for us to know. And spontaneous bleeding versus you scratched it, because spontaneous bleeding for us is more important. Again, it's growing and it's a slow grower. So that one we depend on the patient to let us know. The usual presentation is that of a little pearly nodule with a blood vessel, and we biopsy them, and then we treat them with usually something called Mohs surgery, which I'm board certified to do. Mohs surgery,
No, that's going. Go into Mohs surgery. Yeah, tell us.
It's basically a layer-controlled removal of the lesion. So we remove it in layers in conservative approach, so we don't overtake. And then we take it to a lab, which is usually in-house. And then we look at it in the microscope, make sure we got it all, that the margins are all clean and clear. If so, we sew it up, end of story. And usually that lesion never recurs again. It has a success rate over 98%.
Wow.
Is probably the best in medicine.
That's incredible, right?
Yeah, because the way we look at the margins is very unique. And I won't get into the technical aspects, but it's not the typical bread loafing, so we tend to not miss the cells that could be escaping in conventional pathology processes. So anyway, Mohs is for basal cells and squamous cells, which is the other type of skin cancer, are the way to go. Particularly in areas like the nose, the ears, the lips, and I recommend, please do not cheat the sunblock on those areas, because those lesions can be, if you let them go, if you don't detect them early, they can be very disfiguring to deal with later. And people care about scars
how they look,
and how they're going to look after surgery. Well, the time to worry about it is not once the lesion has taken form and shape and has taken roots, is preventing it. And that's why if you're going to cheat on anything, make sure you put the sunblock on the ears, the nose, and the lips.
Wow, that's what I've heard. It's protection, prevention.
Yes.
That's the biggest thing.
Yes.
All right, and then let's get lastly into melanoma. Obviously, very bad cancer. You talked about it's melanoma. We always think of a dark spot, but you say there's colorless melanomas.
Yeah.
Tell us a little bit about melanoma,
Right.
How it's treated as well.
So in the typical melanoma presentation, you have a darkening lesion, and it can arise from a mole, which 50% of them can arise from moles, or it can arise what we call de novo on its own, because you got a sunburn, because the sun did a number on you, and you were that unlucky. So there are certain patients that we identify as high risk. Patients with a high number of moles, a load of moles that it's higher than normal. Patients who have a family history of melanoma. Patients with type 1 skin, meaning the light-skinned patients with maybe blue eyes, red hair. So those patients, we tend to do surveillance on a more frequent basis, definitely once a year. Sometimes we do more than once a year. And if there's a lesion that presents to be problematic, then we're going to either biopsy it or check it again in the near future. So melanoma, the prognosis for melanoma, like I said, has changed. It used to be really, really bad. Now, melanoma has always been about the depth. So you want to catch it early, because when you catch it early, usually it hasn't gone down. The growth hasn't gone deep into your skin, which potentially could lead into the lymphatics and metastasis, distant metastasis. So we want to catch it early, because it's all about what's called the Breslow depth. And every time we take out a melanoma, we look for that number. It's a parameter that gets reported to us, and from that we can predict how things are going to go, usually. And the shallower the melanoma, the better the prognosis. Now, with melanoma, the explosion in treatments has, even for melanomas that are deeper, we have adjunctive therapies that get added to the mix in the form of immunotherapies. And even some of these melanomas get analyzed for genetic mutations that then the oncologist can tailor make a program of immunotherapy for that particular melanoma. So what's happening, it's an explosion of knowledge and research that has really, really turned the corner on melanoma. Hopefully this will keep going.
Wow, that's great news. That's great news.
Yes,
Great news.
yes.
All right. Well, obviously, we've learned quite a bit. We've learned about sun protection, sunblock, protecting your skin. We've learned about the vitamins for the skin as well, and using certain vitamins during the daytime, using the retinols at night as well, and then surveillance. I think if you had to give us one piece of advice, I think what I hear you say all the time is sunblock. Don't cheat on the sunblock,
don't cheat on the sunblock.
And I guess pay attention to your skin if you notice.
Absolutely. Pay attention to your skin. You know best. You know your skin best.
All right. Yeah. Well, obviously, it's Healthy Skin Month, and I want to thank our dermatologist for coming and talking to us with it, Dr. Flores here, who's got a few offices. And obviously, if you need evaluation, seek evaluation with Dr. Flores or your dermatologist, and keep that healthy skin. Well, thanks for coming. Thanks for spending some time with us. And once again, Dr. Anthony Gonzalez with Miami Community Health, reminding you to stay healthy, be healthy, take care of yourself and your family, and take care of your skin. November is Healthy Skin Month. Have a great day. Thank you.